Hi, my name's Kelly. I'm a psychologist and CBT therapist, and today I just wanted to talk a little bit about thoughts. So we all have thoughts. Some of us find it really difficult to manage negative thoughts. Some of us have more anxiety-based thoughts. But when we are either working with someone or working on ourselves, one of the key differences that we need to understand is the difference between worries and rumination. And a really clear distinction to help you to understand what we can do with them is asking yourself, what is the thought actually about? If it is a thought that is saying, what if this happens or what if that happens? The what if indicates that that thought is based within anxiety. However, if the thought is thinking about things that have happened in the past and going over those things in the past, that is normally rumination. So it's thinking about past events, past situations, even past thoughts. But the difference is rumination is based on the past, worries are based on the future. And when we look at targeting and changing either one of those, when we look at rumination, we want to treat it like a behaviour. So we want to do something behaviourally to change it. We don't really want to delve in too much to the thoughts, because if we do that, we'll probably get sucked into that past vortex and get stuck in just ruminating it and get stuck in the cycle. So if you or a client that you're working with does ruminate a lot, so remember thinking about loads of things from the past, what you want to do is change what they're doing. You want to shift their focus and you want them to really focus on what they are doing in that present moment. So whether it is doing work, whether it is calling a friend, so getting them to shift that behaviour. Even cooking is a really good way to distract yourself, because you're going through the recipe and you really have to be quite focused on what you're doing, or even speaking to someone else, because again, you're switched on, you're in the present moment, you're not in the past where your rumination is. So that is when we're working with rumination, remember, treat it behaviourally. Now, when we're thinking about those what ifs, those future present thoughts, we want to work with cognitively. So we want to work on with what's going on in the mind. So whether we do something such as worry time, so thinking times, I've got another video on that if you go and check that out. Or if you kind of look at what is it they actually are worried about, what is it that's going on, what are those what ifs, and being able to challenge them, whether that is through cognitive restructuring. Again, I've got a video on that. And that is where you challenge that thought. You look at what the thought is, you look at the evidence for, evidence against, and you try and create an alternative. But worry time is one of a really good way to get someone to feel more in control of their worries, because when they are thinking about the what ifs, it can feel really uncontrollable. So you want to be able to help them to feel that they can control it by using something such as worry time. So that is a really quick and clear distinction about the two types of thoughts. Obviously there's other types of thoughts, but they are the two that are treated quite differently in CBT. So remember, rumination about the past, treat behaviourally, the what ifs, those sorts of worries, future focus, treat cognitively. Hope that is helpful. I've got loads of other videos on my YouTube talking about different CBT skills and psychological skills and techniques, and I hope you find that helpful. Thank you.